America's public enemy number one is drug abuse.
The war on drugs seems like a lost cause. Unless you live in a place like North Korea, it seems government efforts have failed to stop illicit drug use.
Purdue Pharma, the maker of one of the most widely prescribed and abused painkillers in America, OxyContin. In 2001, when Richard Sackler was head of the company, he wrote this email. "We have to hammer on abusers in every way possible," he wrote. "They are the culprits and the problem. They are reckless criminals."
This year, 100,000 people died from illicit drugs. Drug overdose and drug poisoning is the number one cause of death for people 18 to 45.
The massive death toll from the opioid epidemic has many governments pursuing decriminalization as a possible solution.
It's time to move drug use away from a law enforcement model to a health-centered model.
The state of Oregon in the United States and the province of British Columbia in Canada are decriminalizing the possession of hard drugs like coke and opiates for personal use. A Canadian Senate bill is also calling for similar legislation.
So now drug overdose rates in Oregon soaring, nearly a year and a half after that state became the first in the country to decriminalize all drugs up to a personal use amount.
Portugal springs to mind as a more long-term example of what happens after decriminalization. They were known in the late 90s as a mecca for heroin use. Now, after 20 years of decriminalization, they maintain the lowest drug use rates in the European Union. People seeking treatment there has also increased by 60%. According to the Transform Drug Policy Foundation, the first few years after decriminalization in Portugal saw a spike in drug use. That all sounds great, but to be critical, the USA, Canada, and other countries obviously aren't Portugal. Will decriminalization create havens for open-air drug markets, homeless encampments in places like Oregon and BC?
But basically the idea that there are some people in the world who are victims, and to them everything should be given and nothing required or requested in return.
Michael Schellenberger has worked in harm reduction and is the author of San Francisco, a book diving into the addiction and mental health crisis in America. He's worked for philanthropies connected to the likes of George Soros throughout the 1990s, focusing on harm reduction and decriminalization. Now he's running for governor of California and argues that progressive cities like San Francisco have been the incubators of bad ideas that destroy cities. He thinks state and federal governments across the country have failed.
Day one, go to the legislature and be like, here's my legislation for shelter first. That's the first thing. Shelter first, treatment first, housing earned. You don't have an entitlement to your own apartment in LA. You don't just get to go to LA and be like, hey, I'm a homeless drug addict, give me my own apartment. It doesn't work. The other key ingredient that we don't have is professional, assertive case managers where somebody is tracking your progress. If you're arrested or you overdose and you go into rehab, before you get out, there's a plan for you so that you don't just go right back on the street and start smoking fentanyl and overdose and die or just become an addict again. There's some plan for you, and we're going to keep a close eye on you and make sure that you commit to that plan. We know that people relapse, but we can reduce that amount of relapsing with a really engaged, good, assertive case manager.
The hundreds of billions of dollars that Oregon will save on enforcing minor drug possession will be used to create around a dozen treatment centers. At least that's a part of the plan. Supervised consumption sites have also been a contentious solution that many governments throughout the West have looked at. Countries like Switzerland have 24/7 sobriety and maintenance dose programs. The Netherlands, Czech Republic, they've also taken the same harm reduction approach. Should addicts be allowed a safe supply of regulated drugs while removing the stigma of addiction?
When you consider this fact, each year we arrest 1.5 million people in this country for drug law violations, and 80% of those folks are for simple drug possession. Decriminalization of possession would have a huge impact.
Dr. Carl Hart is an American psychologist and neuroscientist best known for his research on drug abuse and addiction.
75% of the people who die from a heroin-related overdose death do so because they combine heroin with another sedative, like alcohol or benzodiazepine. The public health education message is simple. Rather than vilifying heroin, the message should be, if you're going to use heroin, don't combine it with another sedative.
Drug users seem to get caught up in a loop of arrest, prison, and joblessness. Only time will tell if policies in places like BC and Oregon go in the same direction of Portugal. If the prohibition of alcohol didn't work, how can the war on drugs be justified?
People will always use drugs. They always have used drugs. We must learn to live with this fact. We already take this approach with other potentially dangerous activities such as sex, alcohol, even driving.